Okay. Hello, everyone. Welcome. Thank you so much for joining us. This is using data and dashboards to move from insight to action, which is the final session of the Understanding and Addressing the Childhood Chronic Disease Crisis Prevention and Action in Primary Care Practice webinar series by the Connected Communities Health Initiative. Next slide, please. Just a couple of housekeeping items. So everyone has been muted on entry. If you would like to ask a question, please use the Q&A tool. The webinar is being recorded. Materials will be emailed out to everyone who participated within a week. And we also love your feedback. And so there will be an evaluation form after the session, which is very helpful for us in gathering information on who attends our sessions. Next slide, please. So just a little bit about the Connected Communities Health Initiative. It is run by our National Training and Technical Assistance Partner Group, who work with health centers to improve the health and well-being of their patients and communities. We provide practical tools, resources, and learning opportunities that support providers to tackle the root causes of health challenges and deliver lasting positive change. And the link to learn more about CCHI is there on this slide. So the purpose of this series is to increase awareness of childhood chronic disease trends impacting young health center patients and their families, to identify the key drivers highlighted in reports and studies, and connect those report findings to community health management, quality improvement, and integrated care initiatives. Next slide. And these are some of the logos of the National Training and Technical Assistance Partners organizations that have worked on this series with us. We are NNCC, the National Nurse-Led Care Consortium, and we are a nonprofit public health organization working to strengthen community health through quality, compassionate, and collaborative nurse-led care through training and technical assistance, public health programming, consultation, and direct care. Next slide. And then also running this webinar with us is CSH. CSH empowers communities to create homes and deliver services that build safe, thriving, and resilient futures. They support affordable housing developers, service providers, and policymakers with the tools, data, and expertise to drive lasting change. And they've been working since 1991 to help create or preserve more than 512,000 supportive housing units. Next slide. And this is just an overview of who will be speaking today. We have Matt Beyerschmidt, the Assistant Director of Training and Technical Assistance at NNCC, Austin Puka, the Senior Program Manager at CSH, Naomi Doyan, the Senior Program Manager of CSH, and Geraldine Gigi Gaona, the Director of Clinical Quality and Risk Management at People's Community Clinic. Next slide. So we would love it if everyone could say hi in the chat, and please enter your name, your credentials, your location, and your role. We love to see where everyone's coming from. It gives us a chance to just kind of see who we're talking to and keep the conversation flowing. Next slide, please. Okay, and then the agenda for today. We are going to be doing the welcome and introductions, which is what I'm doing now. Then we'll be doing some level setting on data collection, strategy and analysis, data quality, compliance, and best practices. And then after that, we will be moving to Gigi, who will discuss the People's Community Clinic and their initiatives. And then after that, we will just do some questions and close out the webinar. So, Austin, is this where I pass it over to you?
Yeah, thanks, Regina. Thanks for getting us started. And everyone, as you're coming in, as a reminder, you can pop in your introductions in the chat as we go on. You might make some new contacts here. So today's webinar, right, we have three kind of main learning objectives. First, we want to set the scene, right? Why this webinar matters, right? So we want to make sure that folks leave with an understanding of how the annual health center needs assessment can really be used to identify disease trends, care gaps, right, and support health centers to align their improvement efforts. We will move from that framing and setting that stage to really taking a more technical look, deeper dive into how dashboards can be used with that information from a health center needs assessment so how you develop a dashboard and then use it to gain a deeper insight and monitor your performance as you implement some of those aligned improvement efforts. And then we are fortunate to be joined by our panelist, Gigi. So we will hear and kind of leave with some understanding around how nurse-led care teams, through the use of the outputs and learnings from a dashboard and other health information technologies are used to prioritize outreach, coordinate follow-ups, and really make meaningful improvements for patients and improve their health outcomes. Next slide.
Thank you, Austin. Just had to get off mute. As many of you know, childhood chronic disease conditions are increasing in both prevalence and complexity across the country. Nearly 40% of US children are living with at least one chronic health condition, and health centers are seeing higher rates of asthma, obesity, and other behavioral health concerns within pediatric populations. While health centers have the access to more data than ever, many organizations are still struggling, and many health centers are still struggling on turning that information into real-time action. So this creates an opportunity to use data more strategically to identify care gaps earlier, improve coordination, and better support children and families. Dashboards did the slide change?
Yes.
Go
back one minute.
There you go. Dashboards can help us move beyond reporting requirements by identifying which patients may be at risk and where gaps exist, but the numbers only tell part of the story. Patient experience is reflected in missed visits, follow-up gaps, adherence challenges that families face every day. Closing these gaps require a coordinated team-based action, many times nurse-led outreach, patient engagement, and strong family support strategies. When this data is paired with an intentional care delivery workflows, health centers can better connect their insight and data to a meaningful action. And I'm going to kick it over now to, I believe, Naomi, CSH.
Sure.
Thanks, Naomi.
Thank you. So using dashboards to create action. A dashboard can be thought of as a summary and even better, a story, one that people can follow and resonate with. Dashboards are comprised of multiple different data sets that aim to make the data more ingestible so that the audience can better understand and address chronic disease trends, care gaps, as well as improvement strategies. Next slide, please. It's important for us to take the time out to explain that data is more than numbers. And to be data-driven, you have to be data informed. And to be data-informed, you have to go beyond the numbers. Quantitative data, it's the numbers, it's the numerical. It really answers the what. What is happening? Maybe 50 people are experiencing ER wait times that are exceeding 5 hours. I absolutely made that up. I don't know if that's a good time or if that's an absolute horrible time. Just made up. But it's easily measurable, right? So we've got our dates. How long does it take to see a doctor or get a follow-up appointment? You've got your dollars. How much is spent on services? How much money are our high utilizers using on services as well? We also have our total occurrences. How many times are people coming to the ER for a specific reason like asthma? Then we have our qualitative data. And the qualitative data answers why. Why are 50 people experiencing waiting times exceeding 5 hours? Qualitative data can be gathered through many different means. You've got surveys, you have focus groups, you've got interviews, or just some other way to get those stories. So qualitative data also includes that other contextual information that a lot of times we think about, we know has an impact on our services and our outcomes, but we don't always see in the data. And that looks like the history, the political landscape, and the physical environment as well. And together, when you put all of this information together, it really makes us data informed. Next slide, please. Taking some time to just do some level setting, many of us engage with data in order to submit reports to funders, team leads, or executive staff. You do it because you have to, but it can be used for a lot more than that. So we want to see that the data collection is being used to be data driven, meaning that the data that you collect holds weight in your decisions. Here we can see this typical data process where we typically start with identifying goals and objectives. What is your organization striving to do? What are the steps that they're going to take to get there? And then we start collecting data. Sometimes the project or initiative, your program or whatever might already have like data established. So you're not always, you already have that data collection there. You might need to alter it a bit. Then you go to analyzing the data. You look at what's the progress that's been done. What's the lack of progress that's been done as well? Where do you need support? And then we come up with a report where you summarize your findings. And we know that reports can be used, like we said, for internal tracking. It can also be used for external community accountability, advocacy, or like existing funding, but also to get new funding as well. And there's many different types of reports that you can engage in. Sometimes we've got dashboards. Sometimes you have an extensive written out report. Sometimes it's a one pager. Sometimes it's a combination of a bunch of different things to make sure that your audience is actually understanding the information. Next slide. Thanks. Okay. The analysis helps turn the data we collect into insight. So we compare the results to targets. We also compare our results to relative metrics. For example, the length of time it sees to see a physician in the ER, and comparing that to our ratio of physicians to patients or people coming into the ER that need to be seen. We identify trends, we identify what's going well and what may need some adjustments and support. And perhaps we understand that there's not enough physicians, so the staff capacity is low to be able to turn out and be able to see people in a timely manner. We dive. In conducting analysis, sometimes it's clear that in order to make a sustainable decision, we need more information. So we do a deeper dive into the data. Sometimes that means that we're collecting additional quantitative data, or sometimes we want to add some qualitative data in that, maybe put out a survey or a focus group to really understand what's happening behind the scenes that the data is not telling us. And then lastly, we decide. Once we have all the information, we can then make a decision. We decide what changes will be made, how is funding allocated, or what our target population or service should be. Next slide. So we like to think of data as a story. It's built around raw data and analytics to convey a compelling and relatable message. It has several components that are brought together to build insight using visualization and a structured story. We start off with the data, which is a thorough analysis of accurate and complete data to create a foundation of your story. We really want to make sure that the quality is there. Many times, analysts, we compare data quality to a mirror. How clean is your mirror? Can you see your reflection? It's the same with data. How clean is your data? How reliable is it? How accurate is it? How consistent is it? Does it give you a good reflection of the people you're serving and all of the hard work you're doing? And sometimes that's really hard to capture because people are doing so much work on the grounds that all of the numbers and even all of the story isn't capturing it, but you want to do your best to do that. Then we have narrative. We've got the verbal or written storylines that are used to communicate insights from data and the context surrounding it. Then we create our visualizations, visual representations of your data and your narrative that are used to communicate your story clearly for your entire audience. Also making sure at this level that whatever your visualizations are, they need to be tailored for your audience so that they understand it. A data story combines facts with context and emotion to inspire action. It's more than charts and it builds on a community narrative. After someone reads your report or sees your dashboard, it really should compel them to do something, anything, whether it be donate, whether it be volunteer, whether it be maybe work a little harder or, put that data quality in just that much more. You really want them to be like, wow, I can do something. I want to do something to help. So remember that a dashboard can be used to tell a compelling story beyond the numbers and metrics. It can dive into patient experience and it can support quality improvement and patient-directed care. Thank you. We can go to the next slide. All right. So,
Oh, I'm here. How you doing? Sorry, I was talking again with the mute on. Let me just go on the slides. Again, I think this kind of repeats what Naomi just covered beautifully. Moving from insight to action. Again, data is UDS that we're using is like the UDS needs assessment and patient staff surveys. You can use insight is the dashboards that identify the trends and the care gaps, understanding the patient story, and then of course a simple action. The action is team-based workflows, nurse-led outreach, screening, and follow-up, and hopefully the outcomes are improved chronic disease management, patient experience, and stronger compliance with readiness. And move on. I wanted to now take a second to introduce Gigi Gaiona. She is a healthcare quality improvement leader at the People's Community Clinic, a federally qualified health center serving Central Texas. She oversees clinic-wide improvement strategies across the clinical quality, patient access, and operational efficiency. Her expertise includes UDS measure optimization, EHR data validation, workflow standardization, and implementation of PDSA-driven improvement cycles. GD partners closely with the clinical leadership to ensure that performance data accurately reflects care delivered and to drive measurable, sustainable, and improvement outcomes. So Gigi is a perfect speaker to speak on this topic, and she has spoken for us before, and we were so impressed, and we know she could speak on this topic so well. We're happy to have her back. So now we'll introduce Gigi Gioni.
Thank you so much. I appreciate the kind intro and for setting a great foundation for this topic. Next slide. All right, so creating actionable dashboards for department level quality improvement. So just to give a little background, our quality department has monthly quality meetings with our individual departments in the clinic. So we have an adult department, pediatrics, adolescent, and Center for Women's Health. And we meet monthly with each of those departments. And there's a core team of the medical assistant supervisor, the nurse manager. We have the population health director, our outreach coordinator, and our medical director attend those meetings as the core group. So people internally developed a clinical metrics dashboard. This was built by our data analytics team using Microsoft Power BI. The dashboard combines UDS measures and internal priority measures, and people also uses Azara UDS measure dashboards. We display the data in rolling 12-month performance trends. We have the ability to filter by the department, and then we also have the ability to drill down to patient level and see those patient level reports as well. And the meetings are led by myself. I'm the clinical quality director. The dashboard has become a shared tool between quality, which is my department, clinical leadership, nursing teams, and community health staff. And then, like I mentioned earlier, these are reviewed monthly at those department meetings. for data transparency, shared accountability, department ownership, and continuous improvement culture, and to be able to rapidly change the course of a PDSA cycle that we're doing. Next slide. All right, so I wanted to highlight our UDS Child Weight Assessment initiative. So using patient-level reports from our clinical metrics dashboard, this was a push that we did at the end of last year to try to sort of catch up on this measure. So we identified patients who had the BMI documented, but were just missing the nutrition and physical activity counseling component. And so the department activated a nurse-led outreach to close out those care gaps. So our pediatric nursing team received that patient registry list and identified those gap patients from our dashboard. The nurses conducted outreach calls to provide nutrition and physical activity counseling to families and patients. This was done over the phone. And care gap closure became nurse-led, team-based, and not solely dependent on provider visits. This also helps families with transportation barriers, which was an added plus. And like I mentioned earlier, this was sort of a push, kind of let's see how much we can do to close some of these care gaps to improve this measure. Next slide, please. Reducing missed opportunities. So we started standardizing this preventive care across all visit types. So instead of just doing nutrition and physical activity counseling at annual visits, we started implementing this across any acute visit, any follow-up visit where we saw that this care gap was open. And so we implemented this to complete when it's due, regardless of the visit type, regardless of whether the patient was seeing their own PCP or another rendering provider. This prevented deferred preventive counseling, fragmented accountability, and lost opportunities during acute and follow-up visits. Every encounter became an opportunity for preventive care. In order to monitor this new workflow adoption, we used Azara dashboards, and we were able to generate a monthly rendering provider report to see a missed opportunity rate tracked over time for eligible patients that were seen during that reporting month. The report was used by the department medical director to identify any delayed workflow adoption. So that's super important. Sometimes we roll out a new pilot, and we are assuming that all the providers are on board and ready to go. And so this really helped to see if there was any workflow adoption gaps and any workflow adherence concerns or any emerging performance trends and coaching opportunities. And this is done by rendering provider, so it was not done by PCP, which helped to be able to see that we were indeed closing that care gap, regardless of who they saw. Next slide. Okay, we also wanted to talk about the an adolescent STI dashboard that we created. Although STIs aren't inherently chronic diseases, they can lead to chronic diseases, and so we wanted to expand on this a little bit more. So our data analytics team developed an adolescent STI dashboard that tracks the following: chlamydia, gonorrhea screening rate, positive infection rate, follow-up visit completion, treatment success, failure rate among those retested, and reinfection rates. Measures are displayed longitudinally to monitor trends over time. The dashboard trends help identify needs for enhanced prevention, education, reinfection, reduction strategies, follow-up tracking improvements, treatment adherence monitoring. It also allows the department to prioritize interventions, monitor effectiveness of changes, and support continuous quality improvement. So I recently did an audit of our patients who are not met for that follow-up visit completion. We set the time frame to be 100 days, and there was a lot of opportunities there in my audit findings. So this is a great way to start engaging our nursing team to improve the education that we're providing to our patients. Next slide. So key lessons learned, dashboards are most effective when paired with operational workflows. Patient level drill down transforms data into actionable interventions. I also want to mention that we also slice and dice the data, meaning that we will, for example, in our pediatrics department, we were looking at no-show rate. And so we started slicing and dicing the patients who tend to have a higher no-show rate, and found that there was significant findings in our race breakdown. So now we're looking into SDO, non-medical drivers of health barriers for those specific groups to see if there's a way that we can meet patients where they're at. Nurse-led outreach expands preventive care capacity, and trend monitoring supports sustainability and accountability. And department ownership strengthens workflow adoption. Next slide. All right, that wraps up my presentation, and I do see we have some questions in the chat, but I'm happy to wait.
Yeah, no, Nimi, that's great. Thank you so much. I will, yeah, why don't we go to the questions in the chat first, and then we'll go to the, the questions that we have planned. Let me hear. So we have Lynette Lazarus wants to know, were the counseling sessions on FaceTime or Zoom?
These counseling sessions were over the phone, but I think it could be more impactful actually if we could do something over video and to be able to show visual examples as well.
Well, like you said, I think meeting where they're at, and I think that if they don't have those access a phone call, I've already neglected to remember that you can do therapy over the phone, not like, in video too, so yeah, it's a really great question. And it says, are we able to see some examples of dashboards? Do you could you direct us anywhere, like to your site, or like maybe maybe you could share some examples later, but do you have any examples you know of that people could look at or share out?
They're all internal, the ones that we have. I can share some screenshots, and maybe we can share out to the group just so they can get an idea.
That would be great. If you don't mind doing that, we'll send it. Well, maybe we can put it in the follow-up email, and that'd be awesome.
Great.
And then we have another question asking, it was kind of back in a little bit earlier in your presentation, you're talking about someone asked, like, who leads the meeting?
Yes. So I lead the meeting, and we have a population health component to it. So our population health director will also sort of take about maybe 20%, 15 to 20% of the meeting to drill down on more of the pay for performance measures and kind of payer incentivized measures, and talk about collaboratively quality improvement related to some of those. But the majority of it is led by myself.
Great. So that's all the questions I see in the chat. So I'm going to move on to some of the questions we have planned out here, and I'll move the first one. So how is your support team your team supported front desk and administrative teams in adopting technologies that improves patient outcomes and reduces scheduling or intake. So what's the relationship with your team and the front desk? I think you can speak. Yeah, so please speak from that perspective. This is directed to either one of you, and I believe this is mostly Regina. Oh, I'm sorry, mostly Gigi. So yeah, so could you answer that question, Gigi? Do you know how this front desk support is, administered in this process with the team?
So something we recently started is engaging our front desk staff with some of our clinical quality measure um, care gap closure as well. So our population health team does text campaign initiatives, and if we're noticing that either the patients aren't responding well to text message, like they're largely like, unread or not ever confirmed, then that list will go to our front desk staff, and they will actually make a phone call to the patient. And in some cases, they even do after hours calls, which in our clinic, that has shown to be much more successful than during the day, because patients are often working. So that has been really great to just support our outreach and improve, access for our patients and close those care gaps. And I feel like we're a whole team, including our front desk staff, and they feel very validated by that work as well, because they feel like they're contributing to our success and outcomes.
Yeah, so that is, thank Austin said that Naomi's looking to see what dashboards she may be able to share. But we also have a question. I think you may have mentioned it in the presentation, but what EHR do you use?
We use Epic Ocean.
Okay, Epic Ocean, you said?
Yes.
And great. And then we have another question. If Lynette, if patients live far, is there any program to give public transportation vouchers in Philadelphia? Children under 12 ride free, as well as those over 65. So the ones needing it would be covered under those ages. Is there anything you can know example of where you are or with your work?
Yes, so we have community health workers that will assist patients mostly through their insurance, or if they have Medicare, they're able to kind of help set that up for patients. But in terms of vouchers, I think we do have some, but it's like a limited quantity per year. But yeah, unfortunately, it's not something we're able to provide nonstop.
Um, that's all. Questions keep popping up in there. So the questions in the chat are good. So I'll move on. Then the question one, that is great. You answered that. Question two, you kind of touched on this. Seems like, but maybe you can state like, what digital tools have been most effective in reducing administrative burden while also enhancing the patient experience around, and also maybe especially around chronic care follow-up. And you've mentioned a lot of tools you're using, but is there anyone that has seemed the most effective?
So the text campaigns have been very successful for this sort of quick, like, hey, you've been identified as due for so and so. Please give us a call. And so we're coordinating with our call center, so they're aware of the campaign that's happening. There's a workflow established so that it's quick and easy for the patient. Once they call, the call center representative is aware of what they need to do. The staff in the department are ready to accept them. We check in with our operations managers to see that we have access to accept patients coming in for these campaigns. So that has been very helpful to support this chronic care follow-up. We're also trying to leverage MyChart utilization, especially in our PD and adolescent populations, especially because they're more savvy, with using technology, and that's been a great method of communicating follow-up care and things. But we try not to rely too heavily on the MyChart, just because if it does go unread, we still make the effort to make that outreach over the phone. So it's not just a one and done thing. We are checking to make sure that those are received and read. And let's see. Yeah, those are the main pieces of technology that we're using.
That's kind of been kind of a familiar trend I've seen with a lot of speakers in their outreach in general, is the texting has been really effective. And it sounds like also for you, kind of like not cold calling, but calling people directly seems really effective. And Naomi, do you have any response to this question at all on digital tools? Have you researched or heard of any digital tools that have been really effective in the healthcare center regarding patient follow-up and closing care gaps?
Yeah, I think it's really interesting when we see, mostly not in the medical field, so just to power, but we a lot of times do see that people are looking to match the medical field with the housing field because outcomes, if they don't have that stable housing. And so we have been seeing digital tools like APIs being used to share data. We are also seeing people starting to embed AI, not generative AI, but just AI to help with workflows so that we are cutting the administrative burden. It takes a lot of time to sometimes do a client level analysis when you're trying to pull in data from so many different sources. So, some digital tools that we've really seen a lot lately are the use of like APIs, which allows your software to talk to each other. Because even in one program, your finance team could be using Salesforce, your patient care team can be using something else. And so having a place where I can see everything about that patient in one space and I can say like, oh, great. They Thank you, Austin, and I'm very sorry. Um, yeah, so having a place like a health record that is beyond just what I saw at this one location that also integrates, maybe you have a mental health provider and it brings that in there. Maybe also links with your HMIS to see like, hey, we're wondering why they aren't following up to these appointments, why we can't hold them, and you realize they don't have housing stability. And so I think to me, the best tools I've been seeing with that are APIs. And I know it's very, some people love it, some people hate it with AI, but I think it depends on how you're using AI. Make sure you're using it ethically, but to decrease staff burden, administrative burden, I think AI is also a wonderful tool to use.
Great. The next question. She's used this directed towards you. I think you kind of just explained how do you ensure the frontline staff feel confident and supported when new technology is introduced to daily workflow? But it sounds like you've touched on that extensively, around like, I know frontline is different than front desk. Maybe you can talk on how they're being supported. But I think you've kind of laid it out in your plan, but you can answer that directly, please.
Okay, yeah. So we do like to pilot things with smaller groups. So sometimes we will pilot something with like 2 MAs and kind of work out the kinks and the issues that they're running into. At times, it's a provider and MA sort of duo. So, we'll have a small pilot of 2 of those groups. And for example, with our colorectal cancer screening, we've recently implemented Cologuard. We have 2 provider and MA dyads that are rolling that out and seeing, it's a combination of the provider and MA experience and their feedback, as well as the patient. We're also reaching out to the patients and seeing what their experience is with using the new tool. And so that's been really helpful to just pilot something at a small scale work out some of those issues, and then once we're ready, we'll spread it to the team.
So,
And for the group, if folks still wanted to take a look at a dashboard when we wrap up with questions, if we want to pause the recording, Naomi can share screen.
Yeah.
And
great. And then we'll go to the next question really quick. Where do you see the biggest opportunities for HCCNs and health centers to streamline multi-site coordination across health centers? Do you see like a big opportunity in these areas? Sorry, Austin, I asked that question for you, but that's the fourth question. Yeah, so could you speak on that, Gigi, possibly?
Okay, I'm trying to sorry, understand the question. Biggest opportunities in health centers to multi-site coordination. I think this is an area that we are still, to be really frank, working on, and to standardize just across our multiple sites, because sometimes we do tend to get a little bit siloed. So something, a change happens in one site and then it doesn't really make its way to the other site. So it is something that we're working on to improve at our clinic.
Yeah, why don't we pause it real quick and then we'll I'll stop sharing. So, we also have like a patient experience tool we can share out with the group too, that you can like click around on, and that tool shows you dashboards, and helps you and we'll drop you the link to the download, and it gives you a background on the tool. But it's if you want to if you want to click around with a tool like that to see how you can create your own dashboards using it, we can share that out too as a follow-up email. Let me go to the fifth question we have for Gigi or Naomi. And I said I want to also open these questions up to the audience. If anybody has comments or answers to these they want to drop in the chat, feel free to do so. Again, so the question is, what lessons have you learned about implementing tech-enabled workflows that balance efficiency and maintaining a human, welcoming front desk experience?
Yeah, so our clinic has recently implemented welcome tablets, so that has helped with a lot of the paperwork that the MAs were having to do once they called the patient to the back office, and that took time away from the visit or just prolonged the visit. So those welcome tablets are really helping that frontline staff be more efficient with their time. And then with our front desk, we've also been really fostering this idea of the AIDIT model. So it's about, introducing yourself, stating, welcoming them with like a warm and with warmth and kindness, keeping them informed about things that are happening, if there's a long wait time, if, provider's running a little bit behind. And to continuously check in with that patient if the situation changes. So that's also been very, very helpful. We're already seeing really good anecdotal, evidence of the AIDIT model really helping our front desk with that friendly patient experience.
Great, that's a great idea. Great options. Anybody else have an answer, or look in the chat when they raise their hand, or but thank you, Gigi, for that. This is the time we leave for questions, but we have answered questions along the way for people. Does anybody have any remaining questions? Feel free to raise your hand or drop them in the chat. We'll give you a couple seconds to do so. If not, we'll just move forward. But a lot of great tips, Gigi and Naomi, and really appreciate your presentations. I've learned a lot just listening today, and I think it's just a really clear reminder of where meeting people where they're at when you hear about how impactful texting is still and phone calls are still. I think a lot of these care gaps might be from a lack of, human communication. And I think people still feel text and phone calls are still pretty intimate, so it's really, we think about AI and all these things that we're working with, but a simple text and phone call, has a huge impact. And I'll start doing the close-up slides. Again, thank you for all our speakers. If you want to access resources from this presentation, along with materials from the other sessions in this series, which includes toolkits, recordings, past work from the initiative, you can do so at the our website right here is sdohacademy.com/cchi home. And again, we also will be sharing out this content from this session to all of our attendees today, and so keep an eye out for that. And if you at the end, please, you'll be prompted to take an evaluation at the end, so please take a moment to provide your feedback. We would love to hear your feedback to help us improve our future activities. Again,
And
thank
real
you.
quick,
I was going to say,
there's
there's a
one more
question in the
question.
chat that Naomi might want to
Oh,
answer.
shit.
Yeah. A
Go ahead,
lot of
Naomi.
things that people
You have
say is
plenty of
like you
time.
get data paralysis, where they're like, oh no, I don't have the data. I don't have the quality data. I'm not going to do anything. And they just don't act. But the idea is like you can start implementing something and start collecting the data and then change it, right? Because sometimes it's a learning experience. Like sometimes a pilot's not going to be great. Always be open to feedback and making sure that feedback is accessible. But if you don't have the data, but you still have the resources dedicated, start something and start cleaning up somewhere. Like you don't want to, I have that problem where I'm like, oh my God, my data's not perfect. How am I going to make a perfect decision without perfect data? It doesn't matter. Do something because people are waiting. And sometimes days and days go by and people don't have that time. And also funding, funding has a cut date. So sometimes just implementing it, starting to collect the data. And then when you look at it, you're like, oh, we got to change it. So always being open to making that change. Success isn't linear. We say that with patients. It's the same with data.
Yeah, and to add to that, Naomi, I think there's been times where I am very manual in my process. Like just to be able to start measuring something, I kind of have to start, uh, you know, doing kind of myself and starting to build, and even an Excel spreadsheet and maybe doing a bar graph from there and maybe doing a pie chart from there or a line graph. So also your audience matters and how you present the data matters and so that's interesting. But yes, I totally agree. Just start somewhere and then slowly but surely you start getting a clearer picture. Sometimes the best you can do is a proxy, right? Like I don't have the specific measure that I'm looking at, but this is close enough. So let me start here, and then I can start improving upon the data with data validation, doing, a sample chart audit and seeing where the pitfalls are, and slowly but surely, you'll start to improve that data over time.
Thank you. I was too busy sharing my screen to see the question. Any other questions? We still have a little bit of time left. We're happy to stay on. Again, the evaluation link is also in the chat if you want to click on that, but you will be prompted to take it afterwards. Well, we're give you 3 minutes back, everybody. Thank you again for everybody for joining us. And you'll be hearing from us, in a day or two regarding a follow-up email with all the information you heard and seen today. And thank you again to our speakers, and please have a great rest of your day. Thank you, everybody.
Thank you.